Hola, mis amigos y colegas. I'm glad I'm not in the room with you right now because I'm sure you're laughing at my Spanish pronunciation. So I think I'll stick to English. I'm Sam Ahmedzai. I'm a medical doctor from England, and for 30 years I worked as a specialist in palliative medicine. I'm going to give you two short videos on palliative care, and this first one will be covering what is palliative care and why do we need it. So first of all, what is palliative care? The World Health Organization defines palliative care like this. It's an approach which improves the quality of life of patients and their families who are facing problems associated with life-threatening illness. Now, the patients could be adults or children. All my career, I've worked only with adults. Palliative care prevents and relieves suffering of pain and other problems, whether they're physical symptoms, psychosocial, or spiritual suffering. And it does that through the early identification, correct assessment of these problems, and then modern evidence-based treatments. Now, I'm sure you're thinking, well, isn't that what all healthcare does? I think palliative care is rather different. So how is it different? Palliative care takes a different approach to health and social care. For instance, it accepts that many serious diseases cannot be cured, but they can still be treated and palliated. And by palliated, I mean that the symptoms and side effects of treatment that cause so much trouble to patients, they can be relieved using modern evidence-based treatments. Palliative care also focuses more on helping the person who has a serious disease rather than trying to cure the disease itself. It uses the skills and technologies of medicine, surgery, nursing, and other types of care, including social care, psychological care, to allow people to live with a better quality of life. And palliative care accepts that for many patients, death may be coming in months, weeks, or even days, and it helps patients and their families to prepare for dying, and for the families to prepare for the bereavement afterwards. It does all that by taking a holistic view of patients' needs, wishes, and preferences. So who does palliative care actually apply to? Palliative care applies to patients and their families who have a chronic, progressive illness such as cancer, heart or lung disease, or dementia. In many parts of the world, palliative care is also important for people with serious infections such as tuberculosis, HIV/AIDS, or hepatitis. Sometimes palliative care is helpful for people who've been previously quite healthy, but they've had a major acute condition which may cause death, such as a stroke, acute kidney injury, or trauma. And as well as the patients, supporting the families of these patients is very important, especially if the person is remaining at home under their care. Okay, but why do we need palliative care? I've said before, modern healthcare has become very focused on curing disease. It focuses on the disease rather than the patient's own needs. Modern treatments also cause a lot of side effects, and these can be very distressing and important to the lives of patients and their families. Palliative care tries to restore a holistic approach, treating the disease and the treatment and their side effects for the patient and the family. So, ideally, palliative care should exist alongside curative and life-prolonging medical care. It allows us to be kinder, more compassionate human beings. I must say what palliative care is not. And that's because many people confuse palliative care with other kinds of healthcare and services. Palliative care is not the same as just giving reassurance and holding hands. Yes, it can do that, but it does much more. Palliative care is not the same as using complementary or alternative therapies. It can use scientifically validated complementary therapies such as acupuncture or psychological techniques if the patients want these. Palliative care is not only about the end of life. For some patients, it can start right from the time of diagnosis, going on through the whole treatment aimed at prolonging life and then into advanced disease. So entry to palliative care is not based just on the patient's prognosis. It relates more to the needs at any stage, which of course may increase and be more distressing towards the end of life.